everyone. My name is Katie Ruffing. I'm a master's student in the Social and Behavioral Sciences department, as well as an MCH concentrator, and it's my pleasure to introduce our next speaker, who's going to be Dr. Scott Podolsky. Dr. Scott Podolsky is a professor of global health and social medicine at Harvard Medical School, as well as the director of the Center for the History of Medicine at the Francis A. Countway Library of Medicine, and a primary care physician at Massachusetts General Hospital. Podolsky received both his undergraduate and medical degrees from Harvard, and he's been teaching here at the medical school since 1998. He's the co-author and author of several books, including The Antibiotic Era, Reform, Resistance, and the Pursuit of Irrational Therapeutics. He's presently working on a history of the medical journal in the United States over the past 2 centuries, as well as on projects related to the history of controlled clinical trials. But he's here today to speak with us about the history of maternal and child health here at the Harvard T.H. Chan School of Public Health. So let's give him a warm welcome.
Thank you, and it's wonderful to follow Dr. Liu. In the Warren Museum, which is part of our center, there's this device in a box that's labeled Time Machine. We've never actually deployed it, but so if Dr. Liu had us going forward, we're going to go backwards now. So I'm thrilled to get to speak at a symposium in honor of Marie McCormick. I direct the Center for the History of Medicine at the Countway Library, where we have one of the largest history of medicine and public health collections in the world, including the records of luminaries ranging from Benjamin Waterhouse and Walter Cannon, through the massive records related to the longitudinal studies of child health and development, the records of Leona Baumgartner, and of course, those of Marie McCormick. We also hold the institutional archives of both Harvard Medical School and the Harvard T.H. Chan School of Public Health. And Dr. McCormick has been a wonderful ally on our center's advisory board as we've developed and received grants related to the organization of research records. And as Heather Munford, our public health archivist, and Joe Brain have dramatically escalated our efforts to capture the school's history through the papers of its remarkable faculty. So Heather, Joe, and I are personally grateful to Dr. McCormick, and I get the fun task today of tracing the history of maternal and child health as an evolving field and movement over the past century, and of tracing the parallel development of maternal and child health at the School of Public Health. The two histories are tightly linked, and further linked to longstanding efforts to draw attention to vulnerable populations or what would come to be considered the social determinants of health and illness. I'll briefly discuss the field, and I'm highly indebted here to an excellent paper by Robin Harwood, Stella Yu, and Laura Kavanaugh, before moving on to maternal and children's health's evolving status at the School of Public Health over the past century. And here I'm highly dependent on the series of School of Public Health annual reports and yearbooks that have been digitized and made fully available online through the efforts of Heather, Joe, and the school's archive committee. As a field of inquiry, attention to maternal and child health stemmed in many ways from the apparent effects of late 19th century industrialization, immigration, and child labor. At the same time, the advent of bacteriology inspired increasing attention to sanitation and to issues like milk contamination, especially among the poor. In this context, Lillian Wald, founder of the Henry Street Settlement House in New York City and of the Visiting Nurse Movement, lobbied the Teddy Roosevelt administration for a federal children's bureau. She famously asked, quote, "If the government can have a department to look after the nation's farm crops, why can't it have a bureau to look after the nation's child crop?" Unquote. The Children's Bureau would be formed in 1912 under President Taft and led by Julia Lathrop. And while it would evolve over the course of time, it would employ an enduring model of linked fact-finding, advocacy, and action. The Bureau's initial efforts were geared towards documenting infant mortality rates, finding that these correlated with housing status, parental earnings, local sanitation and milk quality, and the health of the mother. The Bureau would subsequently not only publish child care publications, but would successfully push for child labor and child welfare laws. And this early era would culminate with the 1921 passage of the Shepherd-Towner Act, providing federal funds to states for child and maternal health programs. While the act, opposed and characterized as socialist by the AMA, would be repealed by 1929, it would further cement the importance of and linkages between maternal and child health in the minds of would-be reformers. In this context, FDR's Social Security Act of 1935 included aid to dependent children, child welfare, and Title V, which entailed funding for maternal and child health and crippled children's services. The same era, in the setting of annual White House conferences on child health and protection, saw increasing attention given to normal growth and development, and the start of the Harvard School of Public Health's longitudinal growth study, as well as similar longitudinal studies across the country. And after World War II, and especially after the 1950 White House Conference on Children and Youth, the federal government began an expansive extramural maternal and child health research program, catalyzed by Helen Whitner and by Martha May Elliott, focusing on vulnerable populations and on programs to intercede on their behalf. At the same time, Martha May Elliott, here again, chief of the Children's Bureau from 1951 to 1956, worked with schools of public health to strengthen maternal and child health teaching and research. Such funding would only be augmented during the Kennedy and Johnson eras, which witnessed the origins of the National Institute of Child Health and Human Development in 1962 and the launch of Head Start in 1965. And even as the Children's Bureau was formally dissolved in 1969, with its programs distributed throughout other agencies, its legacy continued in the enduring focus on the linked status and development of maternal health, children, and vulnerable populations more generally. As described in the 1996 report on National Title V Maternal and Child Health Priorities, maternal and child health was to, quote, 1, be equally concerned with the psychosocial and the biological substrates of health and disease. 2, consider social equity in health status, access to health services, and use of health services. 3, have a multidimensional and multidisciplinary conception of health and illness. And 4, view the prevailing social stratification system and the ecologies in which parents and children's lives are scripted as powerful determinants of well-being or ill health, unquote. These guiding principles, of course, continue to shape the field today. So against this backdrop, and largely, though not exclusively, through the school's annual reports and yearbooks as a sampling device, I'd like to next trace the linked history of Harvard's own attention to maternal and child health and the social determinants of health more generally. Instruction in pediatrics had begun early at Harvard Medical School in the late 1880s through the effort of Thomas Morgan Roch. And the School of Public Health's first 9 years, prior to 1922, saw scattered lectures devoted to infant mortality in its social, economic, and medical context. But with the reorganization of HSPH in 1922, and reflecting the influence of the Children's Bureau and Shepherd Towner, the school initiated, as Dean Williamson noted, the first program in the country dedicated to, quote-unquote, child hygiene through the instruction of Richard Smith. By 1929, we see the addition to the program of Harold Stewart, who in the ensuing year would begin the landmark longitudinal studies of child health and development, which would be continued by Isabel Valadian and Jane Gardner, and which would, among many other things, establish the very norms for pediatric growth in the following decades. Indeed, we can see the shift in the department's educational offerings by 1932, with growth and development commanding its own departmental subheading alongside morbidity and mortality and child hygiene. And these are all available to everyone online who wants to look at them. The late 1930s through the early 1940s, perhaps in the wake of Title V, saw a more overt linking of maternal health to child health, with the inclusion of maternal hygiene and obstetrical care as a subheading in 1938, and the actual departmental name change to maternal and child health in 1944. This is the name it would retain for the next 3 decades, with a fairly diffuse teaching and research agenda that included pregnancy and normal growth, but also mortality and morbidity for a wider span of age groups. By 1946, as the school itself became fully independent from the medical school, Richard Smith retired, and Harold Stewart became department chair, again broadly defining the department's problems as, quote, having to do with many fields of science, some related to the health and welfare of all age groups, but some, quote, of particular importance to the infant or the child, unquote. The annual reports don't change much again until 1957, when Martha May Elliott became chair of the department, with its programs presented expansively, and is, quote, based on scientific knowledge of the mother and child and of medical, social, emotional, and cultural conditions during maternity and childhood. William Schmidt would replace Martha May Elliott as department head in 1961, and we see during this critical decade still more overt attention given to health disparities and their causes. In an article in the 1964 school yearbook, Schmidt told students, and I don't know what's going on this slide. If anyone here does know, I'm happy to hear it. But he told students, quote, when the infant mortality rate in one health district of a city is more than 2.5 times greater than the rate in another health district, I think we have a problem. Among the department's studies were those devoted to variation in prenatal and child care in Cambridge, and Leona Baumgartner would herself arrive at the school in 1966, further supporting its efforts to reduce infant mortality rates. And while in the 1966 listing, Schmidt could regard maternal and child health services, quote, as part of the total public health program, national and local, to be discussed in terms of integration with related health services and medical care for all segments of the population, unquote. He noted in the 1969 report that planning for the care of mothers and children depends on the particular, quote, aspirational values which society places upon them, their special vulnerability to biological and environmental hazards, and the successive phases of biological change, unquote. Again, we see maternal and child health as both linked to larger issues in public health and the lifespan of the individual, at the same time that we see them described as a focus of unique inquiry in their own right. This tension would continue to play out through the 1970s, reflecting broader changes at the school. By 1976, the department would transform into a division of the short-lived Department of Health Services. Itself comprised of a Division of Health Services Administration and a Division of Maternal and Child Health, and with close association with the Department of Behavioral Sciences. By 1979, we find health policy split off as a new department, and the return to departmental status of the renamed, if briefly, Department of Maternal and Child Health and Aging, chaired by Isabel Valadian, and with a mission defined as, quote, concerned with providing a comprehensive study of the human life cycle and the factors which affect an individual's lifelong health status. This name change does seem to reflect a stated emphasis on an examination of the lifespan of the individual, quote, from conception to senescence within the context of family and community, related to the goal of the department, to provide in-depth understanding of the physical, social, and psychological determinants of health at various stages of the human life cycle, and to promote practical applications of this knowledge. By 1985, while aging would drop from the departmental title, the department's attention to factors affecting lifelong health would persist, joined in 1990 by a stated commitment not only to teaching and to research, but to, quote, involvement in advocacy and community service, unquote. This was the department that incoming chair, Marie McCormick, inherited in 1991, the same year that health and social behavior began as its own new department. We see a revised departmental description with research clearly articulated and divided among, at the time, 6 key topics, including infant mortality and morbidity. Others today will, of course, get to remark on Dr. McCormick's remarkable tenure as researcher, educator, and department chair, but this was clearly a time of tremendous departmental growth, just as it was for the Department of Health and Social Behavior. In 2003, the two departments merged, with Lisa Berkman as the inaugural chair of the new Department of Society, Human Development, and Health. And while I'm sure there are folks here with more insight than I have on this merger, we certainly see the shared commitment of the two former departments in the highlighted areas of, quote, health and social policy, human development, planned social change, and social determinants of health, which first appears in the archives in 1994. And in the mission statement of the following year, quote, to improve human health throughout the lifespan, including a special emphasis on children and adolescents. Such efforts would continue to expand through Ichiro Kawachi's time as department chair, through to the 2013 departmental name change itself to Social and Behavioral Sciences. At the same time, maternal and children's health would be funded at the school by the Federal Maternal and Child Health Bureau as an interdepartmental concentration and center of excellence, drawing upon faculty from the Social and Behavioral Sciences Department. So what are the enduring themes and lessons from this more than century-long history of maternal and children's health, and from these linkages between national and local efforts? First, from the beginning, whether in DC or here in Boston, it's been grounded in advocacy for vulnerable populations, considered amidst the long-term consequences of the social determinants of health across the lifespan. While research has become ever more sophisticated, we can see this enduring ethos from Lillian Wald, Julia Lathrop, Martha May Elliott, and Marie McCormick onward, and it's quite a legacy to transmit. Second, while this ethos has endured, the challenges faced by women, children, and society first enunciated over a century ago regarding societal inequities and the burden faced by vulnerable populations, of course, endured today. And one could argue there's never been a more critical time for such a department, as Dr. Liu so eloquently described. Third, having said that, while this ethos has endured, it's certainly been parsed in different ways over the century, evincing the tension between a focus on maternal health and a broader focus on the lifespan and human society, evidenced by the multiple and evolving name changes of the department, division, concentration, and discipline. And finally, from the very beginning of the formation of the Children's Bureau, we see a critical linkage between research and its translation, and between the design and evaluation of interventions, though we do certainly still have ways to go. These are linkages that Marie McCormick certainly further developed during her tenure, which has seemed such a critical component of the department as well as maternal and child health concentration today. So thank you.